Hello, my name is Michael Phillip, a physical therapist, and in today's video we're going to be diving further into the anatomy and physiology of foot drop. We have discussed foot drop in previous videos, giving you an overview on the causes, treatments, and with purchasing an AFO. But today I want to take a couple minutes to better explain the most common causes of foot drop. With my patients, I feel that the more knowledge they have, the better and more involved they are in their treatment and the better outcomes. As mentioned in my previous video, the most common cause of foot drop is injury to the peroneal nerve as it passes around the outside of the knee. The peroneal nerve is a branch of the sciatic nerve that wraps from the back of the knee to the front of the shin and travels down your foot. Because it sits very close to the surface of your knee, it may be damaged very easily. This can be caused by prolonged compression of the nerve while sitting cross-legged or having your leg leaning against something hard, a sports impact injury to the knee or lower leg, or even a hip or a knee replacement. Nerves are part of the electrical wiring system that carries messages between the brain and the rest of the body. Motor nerves carry messages between the brain and the muscles to make your body move, and then you have sensory nerves that carry messages between the brain and different parts of the body to signal pain, pressure, and temperature. Most nerves, such as your peroneal, have both sensory and motor components. Pressure or stretching injuries can cause fibers within the nerve to break, which may interfere with the nerve's ability to send or receive signals without damaging the insulating cover, similar to a wire you find in your home or electronic device. However, nerves can heal, and with time, this injury is likely to fully heal and you can likely make a complete recovery. However, when a nerve is cut, both the nerve and the insulation are severed, and the ends of the fiber furthest from the brain dies. But the end that is closest to the brain does not die, and after some time may begin to heal by developing finger-like sprouts that begin to look for the partner end. If those sprouts reach out to each other, your function and/or sensation will be restored. If not, surgery may or may not be an option to repair the damaged nerve. Compression of the peroneal nerve can lead to pain, numbness, and/or weakness of the foot, ankle, or outer portion of your leg. Once a nerve is injured, the symptoms will typically occur below the site of the injury and can last for minutes or hours, or with a more severe injury, it can cause months or a lifetime disability. The common peroneal also has multiple branches that vary in function. Some branches innervate our skin, and so compression or injury of this portion may only cause numbness or a tingling sensation to our outer leg or foot. And then you have other branches that support our muscles of the lower leg and foot. Most notable being the anterior tibialis muscle that controls your ability to lift your foot off the ground. The tibialis anterior muscle runs along the front to outside portion of your lower leg. It begins just below the outside of your knee and inserts into your foot just below the front of the ankle. The most important function of this muscle is to lift the foot during gait so you do not drag your toes on the ground, which can be a fall hazard. It also controls your foot as you strike the ground with your heel during walking, allowing your foot to slowly lower to the ground, giving you more stability and preventing the notorious foot slap that is associated with foot drop. When this happens, likely an AFO will be prescribed to improve that ankle stability and prevent you from tripping over your toes. So there you have it. That's the basic anatomy and physiology of foot drop. And make sure to check out my other videos if you haven't already if you suffer from this condition. Till next time, take care.